Welcome to Vitality Digest. Let's talk frankly about a topic many couples still shy away from. How can your woman truly reach the peak of pleasure and experience female ejaculation? Squirting. This isn't a myth or something only seen in movies. It's a completely real physiological phenomenon. And with the right understanding and open-mindedness, you can absolutely help your partner experience this incredible moment. I want to share a science-based approach combined with a deep understanding of female psychology and emotions. Remember, this is not a competition or pressure to perform, but a journey of discovery and connection between two souls, two bodies. Part 1. Preparation, Unlocking Emotional Comfort. Psychology, the first key. Before starting any intimate session, the most crucial thing is helping her feel completely comfortable, both physically and mentally. The first step may sound simple, but is extremely important. Remind her to use the restroom beforehand. Why? When you stimulate the G-spot, it is closely connected to the Skene's gland, the source of the fluid released during female ejaculation. This creates a sensation similar to needing to urinate, and if her bladder isn't empty, she will tense up, clench, and lose focus completely. You can say it gently and charmingly, "Honey, we're about to start the main event. Why don't you use the restroom quickly to relax and then we can go all out?" Trust me, this thoughtfulness will make her feel cared for, not awkward. And here's the crucial part. Explain to her beforehand that if she feels like she needs to pee during the process, it's a good sign. It means you are stimulating the G-spot correctly. Saying this out loud will ease her anxiety, stop her from holding back, and allow her to relax. Environment, the safe space. Do not underestimate setting the scene. When a woman reaches orgasm and ejaculates, the amount of fluid released can be substantial. If you're unprepared, wet sheets or her feeling embarrassed can instantly kill the mood. Things to prepare. A clean, thick, and absorbent towel laid out strategically. Scented candles or soft music if she likes it. Dim, soft lighting, nothing too harsh. Familiar scents that make her feel at ease. This not only makes her feel safe, but also stimulates her brain to release oxytocin, the cuddle hormone that helps the body achieve pleasure more easily. Furthermore, a well-prepared space shows your respect and care for her. The golden rule, no pressure. This is what I want to emphasize the most. Never create pressure for her. Say things like, "Just relax, honey. We are doing this to enjoy the moment together. There's no need to stress. Whether it happens or not, I love you just the same. All that matters is that you enjoy it." These words are a magical elixir that helps her let go of all worries. When she trusts you and feels no pressure, her body will respond much more naturally. Part 2, Foreplay, the journey of patience. Women are not on-off switches. This is the mistake many men make, thinking that just jumping straight into focusing on her genitals is enough. The reality is the exact opposite. Women are not like men with an on-off switch. They need time to build up energy, for their emotions to ripen. Imagine you are cooking a delicate dish. You can't rush it. You need careful, deliberate steps. The 3 to 5 minute rule for each zone. Start gently from top to bottom. Neck and nape, 3 to 5 minutes. Soft kisses, light breathing into her ear, gentle nibbling. This is an extremely sensitive area often overlooked. Breasts, 3 to 5 minutes. Use both hands and mouth. Gentle massage, nipple stimulation. Don't rush. Let every sensation spread. Lower abdomen and mons pubis, 3 to 5 minutes. Caress, gently kiss her waist, stomach, and especially the mons pubis, pubic mound. This increases blood flow to the genitals, helping her warm up slowly. Inner thighs, 3 to 5 minutes. Approach the genital area gradually, but don't touch it immediately. This anticipation creates intense desire. Combining golden fingers and whispered words. Throughout foreplay, don't forget to use your hands to caress her entire body. Gently massage sensitive areas like her breasts, butt, waist, etc. And here is the secret. Women are aroused not just by touch, but by their ears and minds. Whisper genuine compliments into her ear. "You are so beautiful. I love this feeling so much. You're driving me crazy." A sensual compliment, a loving gaze can sometimes be more powerful than the most skilled fingers. Recognizing the warming up signs. How do you know she is ready for the next step? Observe these signs. Her vagina is already wet, producing plenty of lubrication. The area is slightly swollen and reacts more intensely to touch. She starts moaning softly or breathing faster. Her legs actively close and then open. Her body twitches slightly with each touch. When you see these signs, she is inviting you to explore deeper. Part 3. Activating the peak pleasure point. The G-spot, the promised land. This is the pivotal step that determines the success of the encounter. But first, you need to know where the G-spot is, exact location. The G-spot is located on the anterior wall of the vagina, the side facing the belly, about 4 to 5 centimeters from the vaginal opening. When you insert 1 to 2 fingers and make a gentle come hither motion upward, you will feel a slightly raised area with many folds and a spongy texture, different from the rest of the wall. Important note, the exact position varies slightly for everyone. Don't be afraid to ask her, how does it feel when I touch here? Is this the spot? This frank communication will help you find the right location much faster. G-spot stimulation technique. Preparation. Keep your fingernails short and your hands very clean. You can use lube, or if she's already wet enough, you don't need it. Action. Use 1-2 fingers, index and middle fingers. Gently curve them and move in a hooking motion upward. Create a rhythm, 1, 2, 3, stimulate, rest for 1 to 2 seconds, then repeat. If she reacts well, gradually increase the speed and strength. After a few minutes, you will feel the G-spot start to swell and enlarge under your fingertips like a small ball. She will begin to arch her back and cling to you. And here is the vital sign. Many women will say, I really need to pee. Congratulations, that's a sign you are doing it right. Don't stop. Encourage her. It's okay, honey. Just let it happen. You're doing great. Combination. Tip. Double-edged sword. While one hand is stimulating the G-spot internally, use your other hand or thumb to gently massage the clitoris, the small protrusion above the vagina. This area has the highest density of nerve endings in the female body. Combining internal G-spot and external clitoris stimulation will multiply the sensation of pleasure many times over. Many women can only achieve orgasm when the clitoris is stimulated. Sensitive areas not to miss. Besides the G-spot and the clitoris, don't forget these areas. Ears and nape, gentle kisses, light breathing into the ear. Neck, kisses, soft nibbling, even creating a hickey. Breasts, continuous stimulation. Breasts will flush and increase in size by about 25%. Mons pubis. Kissing and stroking this area increases blood flow to the genitals. Oral sex. The secret weapon. According to research, up to 85% of women find it easier to orgasm when stimulated with the mouth and tongue. This is an extremely effective method you should not overlook. How to do it. Start from the outer lips, slowly moving inward. Focus on the clitoris, gentle licking, maintaining a steady rhythm. Combine with a finger stimulating the G-spot internally. Ideal duration, 10-15 minutes. Too long can kill the excitement. Part 4. Recognizing the signs of success. When she is soaring. How do you know that what you are doing is working? Watch closely for these signs. 1. Copious secretions. Flooded with moisture. This is the clearest sign that she is highly satisfied and aroused. Clear or slightly cloudy fluid will be secreted in abundance. 2. Rapid and heavy breathing. Heart rate and blood pressure are high. Her body needs more oxygen. She will breathe faster, deeper, and louder. Her throat may dry out, making her breathing audible. 3. Flushed and hardened breasts. Breasts are one of the most sensitive parts. When aroused, they will flush pink and increase in size, and the nipples will become erect. 4. Arched back, thrusting. When you see her arching her back and thrusting, that's the moment she is nearing orgasm. This is a signal to insert deeper and increase the pace. 5. Clamping legs or clinging. She will clamp her thighs tightly or cling to you or clutch the bed sheets. This is a natural reflex as the sensation of pleasure overflows. 6. Vaginal muscle contractions. Increased blood flow to the vaginal area causes the muscles to contract, tightening around your fingers or penis. You will feel like you are being swallowed. This is a sign that orgasm is coming. 7. Screams of pleasure. The closer to the peak, the more urgent, sensual, and uncontrolled the moans become. This also stimulates you, helping both of you climax together. When she says, "I need to pee," don't panic. This is an extremely positive sign that you are stimulating the G-spot correctly. This sensation occurs because the Skene's gland, the ejaculation fluid gland, is being activated. What you need to do not stop. Encourage her. "It's okay, honey, just relax, let it happen." Reassure her. "You are doing great, just let yourself go." Continue or increase the speed of stimulation. Many women hold back and clench their muscles because they fear actually urinating. This will prevent them from reaching orgasm. Your reassurance is critically important at this moment, the aha moment. As she approaches the climax, increase speed and strength, maintain eye contact and gestures of care, whisper words of encouragement. Do not change movement suddenly, maintain a steady rhythm, and when she achieves orgasm, this may happen. Fluid sprays out in a stream, squirting, or a large amount of thick, odorless white fluid is released. The whole body twitches and spasms. Moaning reaches its peak and then slowly subsides. Part 5, the art after climax, the important difference. This is something many men don't understand. Women are not like men after an orgasm. Men often fall into a power-down state, needing time to rest, but women are completely different. They don't immediately lose sensation. On the contrary, if cared for correctly, they can absolutely continue for a second or third time and still be as aroused as the first. What she needs most right now. After orgasm, a woman's body releases hormones that bring feelings of happiness, but at the same time, she is extremely vulnerable and needs comfort. Do these things. Hold her tightly immediately. Don't rush to withdraw. Let her enjoy the feeling of warmth and complete connection. Hold her close so she knows you are there with her. Kiss her forehead, shoulder, and lips. Gentle post-orgasm kisses have magical power. They tell her that for you, sex is not just finish and done, but a journey of complete connection. Caress and soothe her body. Gently stroke her hair, back, and hands. You can lightly wipe her with the clean towel. Say sweet, sincere words. "You were incredible. I'm so proud that I got to make you climax like that. I love you so much. You make me so happy." It might sound cheesy and overly romantic, but trust me, for women, this is the medicine that maintains the emotion after the tsunami. They need to feel loved and cherished, not just as a sexual object. Communication, the key for next time. Don't skip this step. After you both have relaxed, share your feelings. How do you feel? Is there anything you like the most? What can I do next time to make you enjoy it even more? Is there anything you'd like me to change? These open conversations not only help you better understand her body and desires, but also create a deeper bond. A couple who knows how to explore and learn together will find sex is no longer an obligation, but a never-ending game. Final word. It's a journey, not a destination. Finally, I want to remind you of the most important thing. Female ejaculation is not a goal to brag about or a burden to make happen. It is the natural result of a journey of love, exploration, and genuine connection between two souls, two bodies. When you make her feel enough trust, safety, and relaxation, she will not only squirt but also regain faith in her own body and self. If you don't succeed the first time, don't be discouraged. Helping a woman climax doesn't always go smoothly from the start. It requires coordination, understanding, and most importantly, regular practice, which is the most fun part. Encourage her to explore her own body. Ask, which position makes your G-spot feel clearest? Or, when I touch here, does it feel similar to when you do it yourself? And don't forget to take care of yourself. Exercise regularly. Get 7 to 8 hours of sleep every day. Practice Kegel exercises to increase stamina. Eat a balanced diet. Because a woman is a delicate safe, it only opens when you have the correct source code: patience, understanding, respect, and sincere love. Believe that you are not only good in bed, but also a man who knows how to listen, cherish both the body and the soul of the woman you love. And when that happens, lovemaking will become a beautiful symphony with low notes and high notes, climaxes and pauses, and every time will be a memorable work of art. Did you find this article useful? Subscribe to the Vitality Digest channel so you don't miss out on quality articles about health, sex life, and family happiness. We are committed to bringing you the most scientific, open, and practical knowledge to help you and your loved one have a better life every day. Subscribe now to get notifications about new articles weekly. Wishing you and your partner wonderful, soaring moments. Disclaimer. This article is for educational and knowledge-sharing purposes. If you encounter any physiological health issues, erectile dysfunction, premature ejaculation, painful intercourse, etc., please consult a specialist doctor for appropriate advice and treatment.